You're listening to We All Wear It Differently, a podcast for early career psychologists. Your window into the world of the psychology profession. And now your host, Amy Fellman.
Hi everyone, welcome to episode 63 of We All Wear It Differently, brought to you in collaboration with the Australian Psychological Society as part of Psychology Week 2020. This year's theme is pain, finding the way forward with psychology. And in today's episode, I chatted to Dr. Nicki Ferencz, clinical psychologist and clinical coordinator of the Paediatric Chronic Pain Service at the Women's and Children's Hospital in Adelaide, South Australia. For more on Nicki, check out the show notes. Before we get into the interview, the APS has provided Wowwood listeners with a 10% discount code for a 2-hour Introduction to Pain Management training module developed through consultation with Australia's leading experts and researchers. So go to psychology.org.au/we all wear it differently and use the code WOWID to redeem your discount. And now for the interview. Just a heads up, there was some minor audio interference throughout, but don't let this distract you from this insightful conversation with Nicki. Now, let's see how we all wear it differently with Dr. Nicki Ferencz.
Hey.
Nicki Ferencz, welcome to We All Wear It Differently.
Hello, how are you going?
Really good. It's great to be connecting now that we've got our times aligned. You're in Adelaide, I'm in Melbourne, so...
Yes. Sunny Adelaide as well today, sunny and cold Adelaide.
We usually get Adelaide a couple of days after, don't we? Is that how it works with the weather?
You might be right there, actually. Yeah, I think it's kind of like goes that way, heads that way. So you've got some nice sunshine heading your way, actually.
This is so cliche. We're talking about the weather to begin.
Well, I am English, of course, so I should have a cup of tea, shouldn't I, as well? That would be really good.
So, Nicki, so let's start with you telling me a little bit about how you first discovered psychology and what got you interested.
So, psychology, well, I think I'd have to probably go back to the UK really there then and start a little bit about my background, because it's very different here in Australia, I think, to the UK, where the training is slightly different for starters, and also I think my own particular background. When I went to school, it was a long time ago now, and we had I went to a school which didn't particularly, I would say, didn't favour going on and doing, interesting careers like psychology and curious things like that. And I thought to myself, I really want to do something interesting. I want to do something different. And so when they said to me, "Oh, go and get a job," I thought, I'm not doing that. I'm going to go and study. And I came from a kind of like a background that we, first generation of kids that didn't go off to university, so it was different for my cousins and my siblings to go to university, and that's what we did. So we broke the mold, and I studied psychology, and you know what? It was fantastic, just fantastic. I studied at Sheffield University to begin with for my undergraduate. And you went away to study again here in Australia. Our kids are very fortunate that we can keep them cozy, although I'm not sure the teens would appreciate that. Maybe they want to let their wings flap a little and fly, but it's costly business to go to university. So yes, I went and studied away at halls of residence, and off I went to Sheffield University and studied undergraduate psychology there. It was fantastic, wonderful. Never looked back.
You said that you were really curious. You wanted to do something, really interesting. What was it about psychology that grabbed you?
So I'm nosy. I'm really nosy. I like to. I mean, my teenage kids will tell you, Mum, why do people tell you things? Why do people talk to you about things? And I don't know. That's probably because I am nosy. So it seemed the perfect profession, because I'm interesting now when I teach psychology. I teach professionals, and I say to professionals, when you're in the room with that person, they are the most important person to you at that moment, and if they believe that there is nobody more important than them to you at that moment, you're doing a good job. And so that's my motivation to make a difference in that way. And I think psychology does that. It gives you that opportunity to be able to connect with somebody else and travel with them. And I'm curious about how different people see things in different ways, and I'm motivated to make change in that process. I think I'm not a small thinker. I'm a bigger thinker. So I'm not very good when people say, "Oh, it's like this." I always say, "Well, but it could be this." And psychology allows you to think like that. It allows you to think, "Well, it could be this, or it could be this, or it could be this. What's really good for you right now? What can we do that's actually going to be different or better or more creative or work better for you right now?" And there's no limit on that. So psychology allows you to think in that kind of way. And look, I think we live as psychologists for those moments in therapy where your patient or your client or the person that you're working with goes, "Oh my goodness, I hadn't thought of that. I hadn't thought of it like that." That's my drive actually in therapy. When they go, "Oh yes," and that aha moment. And so that psychology allows you to do that. And there's just that's great. That's really fantastic.
I'm just imagining you working with people with chronic pain syndrome, feeling very stuck.
Yes, very. Yeah.
Beautiful moments of what you were just describing, of somebody going, "Oh, there is actually another way to live."
Yeah.
So powerful.
Yeah. Well, and particularly for teenagers, because, if you think about it, we live in a world where it's school particularly, you have to have rules. You have to have rules to survive and get by and get through the curriculum, and any teacher will tell you it's full on. So sometimes that can feel very restrictive. So when teenagers particularly are struggling, those rules can feel very restrictive and very binding. So to have an approach where you say, "Oh, okay, then, we can't actually go in the front door at the moment, but let's creep round the back. Let's open the back door and let's see what's in the back of the back garden, and let's see what's round there, and let's just see where we go." And that's incredibly empowering, to be able to investigate, what's in that person's back garden and what's in the room that they don't normally go in. And, I wonder what we'll find. And that's really, I love that. Absolutely adore that.
So what brought you to Adelaide from the UK?
Well, I was fortunate enough to I'm a traveller. So I came out here and visited this wonderful place. It's just glorious. Where I live in the UK, we lived in a very rainy and a very busy place, and I came to this sunny place with really friendly people, and I thought, "Oh, this is really nice. I like it here." And I was very fortunate. My husband actually, who is an engineer, was able to have work here. So very fortunate opportunity. And I was actually an early grade psychologist at the time. I emigrated out here in 2002. So came out here with my young daughter at the time, and came out here to stay. And at the time just came out and thought, "Oh, I'll stay a couple of years, see how we go and enjoy this wonderful place." And look, it's just grown on me, and this is my home. My son was born here now, so this is home, and I'd much rather stay here. We go down to the beach down on the Fleurieu Peninsula. Not that you know these beaches, but you have beautiful beaches in Victoria as well. We have gorgeous beaches down here.
Beautiful beaches in Adelaide.
We have the most gorgeous. Yes, we do.
You do.
15 minutes away. So, it's just delightful. And I go to the beach and my kids laugh at me because I just sit there and go, "Look at this sea. Look at this sand. Look, it's green. The sea's green. How fantastic is that? My kids go, oh, for goodness sake, Mum.
It's already clear to me why you've ended up working with kids. Your insatiable curiosity aligns with my 3-year-old son.
Yes. We'd have fun.
So tell me then, so you built your career here as a psychologist. How did you end up working in chronic pain?
So, that really is kind of just curious how all that came together as well, because when I came out here, I started off in corrections, actually, because I have a background working with offenders in the correction system in the UK, but with mental health. And so it seemed natural to fall into that when I came out here. But the difficulty is when I had my second child, was that he had lots of health issues early on. And so I found it really difficult to work in government in a full-time position, and ended up in private practice because it was more flexible around supporting my young family at the time. And so I would often have patients with chronic pain in private practice, but more particularly, I have lots of teenagers. I worked for the first time in my local community, and which was quite interesting, coming from a city in the UK where nobody knows everybody, and it's quite anonymous, to working in your local community where you go in calls and people say, oh, hi, Nicki, hi, Nicki, hi, Nicki, hi there, how you going? Was quite an interesting experience, and particularly working with teenagers from the local schools. So had lots of just really enjoyed that kind of work as well. So when I went back into government work and worked in acute services for burns and stroke, that again, another layer of working with pain. And then when I'd also got involved in some research using hypnosis and pain. So when we didn't have a paediatric service for chronic pain here in South Australia, we're really significantly playing catch up compared to the other states. When that service developed in 2018, it really was a beautiful fit for me in terms of combining working with teenagers and my knowledge of working with pain. And that was just, it was a perfect opportunity, and I just adore it. So really, really like the work. It fits very well with, I guess, my approaches to using psychology, and also starting something new and looking outwards. What can we do? This is a new service. What can we do to grow this in a way that is innovative and helpful to where we're at right now, but also within the limits and boundaries of what we've got here in South Australia, which is tricky because we're still developing services for chronic pain here, and there are significant challenges for that. In recognising that there might be 1 in 4 children who have chronic pain, just like there are adults, but recognising and growing that population is quite challenging.
And why is that so challenging? I make an assumption that it's because we don't necessarily associate young people with chronic pain. So I wondered, is there just a lack of awareness? Is there a stigma? Is there just a sense that that's all too hard basket because we don't tend to make that association? What are the barriers?
Well, I think it's a number of reasons, really. I think we're quite new in how, certainly pain research has just blossomed relatively recently. What we know about how pain functions has done an awful lot in the last couple of decades, and we're still playing a little bit of catch up there in terms of spreading the word. And also, it's not it might be all pervasive, we all experience pain, we know about it, but actually what to do about it then is we're still playing considerable catch up there. I mean, part of the work that we do for any clinician working with pain is about actually the language that we use to explain what's occurring, and the education, actually educating somebody about how pain functions in the body. So that process is I would say, I often say to clients, if I had $1 for every time somebody said to me that they've been told that pain was in their head or not real, that would great. That would keep me employed, really, because there's a great deal of communication that is actually either incorrect or not delivered helpfully. And I think that we've got a lot of work to do, both within professions, but also within lay community, with teachers, in schools, with professions, with how we understand pain, even, on the TV, we've got a lot to do. I mean, the International Association of Pain have only just rewritten the definition, to take out the word describe, for example, because it was thought for many years that, that if you're a baby or you couldn't describe pain, that you didn't have pain. So, which that's just not true. So, we really are playing catch up with our understanding and delivery of what you can actually do that makes a difference. And it's not that complicated. It's complicated because what we need to do is actually we know what to do. We know what works. We just really need to actually put those things in place to make a difference. And so we really are still playing catch up.
That comment that you made that people will say the pain is in your head.
Yeah.
And you were talking about the language that you use with your clients. What is the language that you use when your adolescent clients come to you with these experiences that have probably really, squished their sense of trust in themselves of actually what's going on? What is the kind of language that you use?
So I think, look, in terms of delivery of pain education, anybody that works with adults or any client with pain, there's a component of explanation of how pain works. With adults, you can have that conversation. With adolescents or with kids, you have to think carefully about the delivery of that, because you're never just working with the child. You're working with the system around the child. So, for example, you're working with their parents, you're working with their grandparents, you're working with their siblings, you're working with the messages that they've received, often for a long period of time. So that language has to be one that is quite representative of where that child's at. And I think the biggest message I've learned there was in my training in hypnosis. I learned that it's not just about the words that you use, but how you use those words. And sometimes the picture that you paint is really important for that particular person. And I think for children and adolescents, you really have to be careful about that picture and how you're painting it, because talking to a 10-year-old is very different to talking to a 13-year-old versus talking to a 17-year-old. And so you have to pitch that correctly. And a teenager is going to tell you if you get it wrong. They're going to tell you either because they're going to switch off, or they're going to tell you because you don't know what you're talking about, and they'll disengage therapeutically. And whereas an adult, you might have an opportunity to deal with that. With a child, as you quite rightly pointed out, Amy, there's a great deal of trust that needs to occur, and that you have to develop that quickly. And so the language that you might use, particularly for therapy, is one of how do you deliver the information that you want to say really quickly, and how do you do that in a way that actually meets them where they're at. And so for me, that's often through story. That's often through, okay, let's what story is it what's your story? Tell me your story. Let me understand what you can see, and then I can see that too. And then let's recreate it. Let's paint it in a different way. Let's, if we colored that a different color, what would it be? What would it look like to you? And who would be in your story? And who do we need to take out? And so it's how do we change the story? And that's the power of, I think, working with certainly teens and adolescents, because their story's often been one of not being recognised, not being validated, not being heard. And I guess, as psychologists, that's what we do all the time. But we have to pitch it really carefully when we're talking about pain, because if we actually get that wrong, we've lost that person. And I think, for example, a particular example about that is you have to think about how many times you even use the word pain. And I deliberately flip that around to talking about, how are we going to get comfortable? How are we actually going to work on increasing you feeling more comfortable? And I deliberately swap my language around to work on where we're going. You're always seeding moving forward. So just even, taking out the word pain to what we're doing. I don't use pain scores very often. I use, well, how comfortable were you with that? And I use a comfort score. Or I'll ask, what was the impact of, rather than what was your pain score, but how much is that actually impacting what you're doing? That's what I'm interested in, rather than, whether that made a difference. And that's quite a shift, because typically people will have come into the service being asked what their pain score is on a regular basis. And don't get me wrong, we do that too. But we're all therapeutically, we actually need to be shifting that along to seeding, actually, how are we going to get you more comfortable here?
And Nicki, what about the word chronic?
Yeah.
I've been wondering about this, because that is a big word, and it means long term. It means forever.
Yeah, absolutely.
So how do you support young people to get their heads around that and to still stay motivated to improve their lives?
Well, firstly, and quite significantly, it's about seeing this as a recovery approach rather than, that this is something that you have to live with. And I think that approach is one of, we're working towards that you're going to be pain-free. I don't know when that's going to be, or how that's going to be, or how that might look for you, or whether it's today, or whether it's tomorrow, or whether it's the next day or the next week. I don't know when that's going to be, but that's what we're working towards, because I think everybody needs that message of hope that this isn't something that they're going to be. It is a chronic condition that is forever, because that's really restrictive. That's just closing your world in on you. And as you quite rightly point out, for a teenager or a child, that's not okay. That's really not okay. So it's one of seeding. Let's work with where we're going here. And the intervention of all pain services is about increasing function prior to working with reducing pain. It's about, how do we get you moving and getting back to school, doing the things that you love? How do we recreate that? And we were doing a program last Friday and talking to parents about that, asking them at the beginning to think about, can you remember what it was like when there was no pain? And most of the parents will cry. It's that powerful. It's really huge for them to be able to remember what it's like when their kids were not experiencing pain. But it's important that they can remember that, because they have to access that to seed. Yes. Actually, that's where we're heading. We're heading there. We're heading to those joyous moments. Okay. And so we need to access that.
Right. They too need to be able to access that too, to hold the
motivation.
Yeah,
Yeah,
absolutely.
and the motivation to make some really hard choices and some difficult steps. The rehabilitation process is really tricky at times. It's challenging to tell a child, well, it's actually going to be helpful for you to go back to school. When they've typically often parents have turned around and gone back home because they've thought, how's my child going to cope? How are they going to get through a day of school? So, going back to language again, you have to dance with your parents and your kids as to see, okay, well, where are we at in this dance? Are we just, at that stage of just teetering around one another, or are we actually waltzing at the moment? Are we ready? Psychologically speaking, what we're doing there is assessing readiness for change. Where are you at in your readiness for change? But, my dance analogy works better. Where are we dancing? Are we actually driving?
I love that.
Oh, good.
Beautiful. So can you tell us a little bit about the types of clients that you see? What are people typically presenting with?
So in the service, they'll present with anything, really. That pain has been around for a period of time. I mean, typically longer than 3 months, but really it's when when normal healing has occurred, we'd expect that to occur, but pain has hung around. So, and that can be anything from musculoskeletal pain to headaches, to pain from complex medical conditions. So really any kind of diagnoses, but what we're typically seeing in terms of the patients that come into the service are usually that teenage demographic. So although the Women's and Children's where I'm employed as a paediatric service will take kids from 0 to 18, typically our median age of referral is a child at age around 13, 14. And I think that's no coincidence that that's also the entry into high school here. It will be very curious over the next couple of years as we transition to, I know in other states, you go into high school a year earlier in year 7. We're in South Australia only just beginning to transition so that our kids will go in at year 7 as well. And that will happen. Some schools are already doing that. But it will happen over the next year or so. So, that will mean it's a year younger. So it'll be really fascinating to see whether our kids, that median age is actually dropping to correlate with high school, because the demands on teenagers when they do that shift from primary school to high school are really significant. Moving just for example, if you have chronic pain and you're moving from classroom to classroom to classroom is such extra load, having lots of different teachers, having to climb stairs to go up into much bigger buildings, to carry your books from different classroom to classroom, to navigate that. And they're just the practical things. Not only are the developmental processes and the social processes that are occurring with adolescents that can feed into those complications as well, that can contribute to keeping those pain systems activated, just really, make things quite complex. So typically teenagers are significant referrals, median referrals for the service.
Mm-hmm, mm-hmm. It was just making me think about the potential comorbidities that might present as a result of the pain, and the way that it would infiltrate lives. You've explained a few, but are there any others that typically present, and do they often present as confused in a way for a therapist, like what's really going on here?
So certainly mental health vulnerability goes hand in hand with chronic pain. So conditions that anxiety, depression go very much hand in hand. So certainly working as a psychologist, we'd certainly be assessing for mental health vulnerability as well as chronic pain. And I think the management for that, certainly in the program that we run, we're also tying into that developmentally where a child is at as well, and their difficulties that they are having to manage socially and academically during this process too. I think the challenge for us there as a small service is that the longer term care, we need to be referring out into the community, and so one of the challenges certainly for South Australia is how we link with our wonderful partners in the community and teen services for managing mental health vulnerability, because there is again another dance in how you deliver your pain education with also treating mental health effectively, and so weaving the two together is very significant. So one of my tasks and roles, significant roles in the job that I have, is also about how I partner with community providers and actually work with psychologists in the community for saying, you know, have you assessed pain if they're working with mental health distress, and vice versa. You know, if we're referring somebody on from our service, how we can support their mental health on a longer term basis when they're actually doing structural work to actually make, you know, to support their pain rehabilitation as well. So they're very intrinsically linked.
So can you tell me a little bit about the treatments that you offer, you know, when someone presents with pain, and also maybe if you have an example just to give us a really good sense of what that might look like for somebody in the room, that would be really great.
So the service that because we're tiny, we are a multidisciplinary team, and we work in a very interdisciplinary way. So our service has a coordinator, which is myself, and we have psychology, and we have physiotherapy, and we have medicine. So and that's, you know, very typical of any pain service that would have that kind of interdisciplinary approach to managing pain well. We know that the gold standard for working with pain effectively is to actually have movement-based intervention, to have psychology for mental health and for managing pain better, and also medical assessment and review of, for example, medications that are going to be helpful, and also, you know, interchange for complications in the body and how that needs to be appropriately assessed and monitored. So firstly, in terms of the delivery of treatment, we would always assess somebody from that multidisciplinary perspective, and that means that when a child comes into the service, they are seen by all of us together, and that's really important because it means that, one, you're only telling your story once, and you're not repeating yourself over and over and over, and we all hear the information at the same time. So that's really important too, that we're on the same time zone of as to where our patient's at. And we work really well as a team together. I'm very fortunate to work with an incredible team. I'm very lucky that I would be 100% confident about the language we support one another and talk to one another and actually pitch our interventions depending on what a particular patient might need at any one time. So, and in terms of that intervention, that's generally going to be some form of movement-based intervention. So our physiotherapists would support that particular program, and our psychologist would support working psychologically with somebody with pain. And the reason for that is that managing pain is stressful. It's really difficult, and as we've talked about before, that for anybody who's managing pain, their world shuts in on them. It really closes down. And so finding creative ways to do things differently. Psychologists are fantastic at that. They are problem solvers, and they, when we started out, which was part of my attraction for the service, is we think creatively for solutions that are in tune with the people that are sat opposite from us as to what's going to work well. So psychologists are good at that. They are problem solvers. So, if our particular teen is having lots of conflict with their sibling because their siblings don't understand the challenges that they're managing, that can be really helpful within the family unit. Equally so, managing at school, psychologists are very good at problem solving, how to navigate communication and advocacy for that particular person for practical solutions like learning how to improve concentration, how to manage in the classroom, how to have the confidence to communicate what you want to say when you have to have a break, and how you have to make time to actually practice pain management skills. And equally so, what's our bread and butter as a psychologist, how we actually reduce stress. So, how we deliver mindfulness skills, relaxation skills, how we understand how the mind and the body connect well, using how we think affects how we feel, affects what we do. So being able to work with a young person to actually say, well, how can we think about this differently? And if I think about it this way, I wonder whether we'll feel differently about that. So all of those skills are really in the pocket of a psychologist to actually address pain. And what we know is that when we think about things differently, that starts to turn down those volume dials on our pain output systems, so we can actually manage better. So psychologists have to, again, sneak in the back door, because, sometimes going in the front is a bit too confrontational. Sometimes individuals are really quite, I would say, cautious at first to understand how psychology does play a role, because they've often heard that you're going to tell me this is, I'm imagining this, or I'm exaggerating this. They may have heard that. They may have experienced a lot of frustration from the people around them about managing pain. So, psychologists are good at helping individuals about how they're going to manage those big feelings and what they can practically do about that. The one thing that is important, I think, you're asked to paint a picture, is that we often do collaborative work together. So it's very powerful when a psychologist might go into a physio session and video. For example, we often take our iPads in to video some of the and record some of the physical sessions, just to because teens will say things, people will say things, parents will say things, and to be able to play that back and to say, look at the change that you've made from, say, this day. And to be able to see that is incredibly empowering. So to be able to, and what were you thinking at that time? So to be able to work connectively with your other disciplines is really, really helpful within a chronic pain service. So our psychologists and physios often work in joint sessions, and physios will come into psychology sessions as well to deliver about movement and about, and often play a role in how, for example, relaxation techniques and mindfulness techniques, and also biofeedback techniques can influence how we feel about at that particular time when we're doing an activity. Equally so, you asked me about how that might look for a child, but that's also about the parent too, and working with the parent. You can't work with the child in isolation. So working with the parent to say, well, what are the barriers for you right now? If you've got to carry, if you're a single parent, for example, and you're carrying these challenges of attending appointments and extra sessions for your child, but you're also having to pay the bills and take time out of work, that's incredibly stressful. So, working with a parent to reduce that stress and teach them skills of how they can problem solve. The ease and the load on them is really important. And what's been going on for them? What other, we know that their own mental health significantly affects the recovery for their child. So if they are not receiving support, then that's going to impede the work we're doing with the child. So whereas we wouldn't offer long-term work with a parent, in order to enable them to find support for themselves, we have to work with them initially so that they can actually, so they know what to say and what to ask for. How do they know what to say? Parents might not even recognize that their own mental health is an important factor. So to validate the stress and the challenges that they've been dealing with is an important part of that process. So I think that journey from that initial assessment to intervention in a coordinated and multidisciplinary way versus then how we link with our community providers is a little bit of the journey for a patient through our service. Does that answer your question?
Absolutely. Beautiful. Yeah. And you may or may not want to share. I'm wondering if there's an example that you might have in your mind of just someone that you've worked with and just giving us a picture of the change of how they first presented and then perhaps, post treatment time, how their life looked then.
So we run a program called the Comfortability Program in the Women's and Children's, which is a program actually that runs out of the Boston Children's Hospital in the States. And one of the elements of that program is to have a peer mentor that comes into the day to talk about their process from beginning to end. And I have to say, what you've asked me is the highlight of the program, because to have what we say as clinicians is nothing compared to a teenager who can actually say, this is where I was at when I sat in that multidisciplinary meeting. I had one patient and she talked about this very thing. She said, I remember the day when we came for that multidisciplinary meeting, and I remember feeling so down and so stuck and so, this is just so awful. I've had this for such a long time. This is never going to change. And here I am today. Here I am where this has made such a difference, and I'm back, and I'll talk about her because she plays women's football and she won her league that year, and she was back at school and she was back with her friends, and she had many learning difficulties at school as well. She had dyslexia and found learning extremely challenging, and she hadn't worked out how much her mental health had contributed to her feeling really quite disempowered about the whole process of valuing her school. And she came back to deliver her story to the group, the teen group, about here I am now where, yes, I still get some tricky days, but I'm back at school full time. I'm playing football, regularly, and we've just won, so I'm so happy. My mum wasn't too happy with me doing this, but we're okay. Absolutely. but that's good. And I really am enjoying this. This process has been really helpful to me, and so I can talk about this story now, but she has the power to deliver that in a way that I never can. And equally so, her mum, because we have a parallel parent program that runs at the same time as the teen program, where their parents come in, and a parent comes as a peer mentor to talk about their process and to talk about, how I never would have believed that I could have my child back. I never would have believed that I could actually have laughter. We ran the program on Friday, and the adult, the parent peer mentor in the program said, I cannot tell you how, as a parent, it feels to hear my daughter laugh. She didn't laugh for years, and to hear her laugh now is the biggest joy. And it just, you just think the things that we take for granted are just, and there are other parents in the room listening to this story who identify, because they're at the beginning of their journey, to see that hope that, that they've got their daughter or their son back, and enjoying that interchange with them, and that they're doing things autonomously for themselves. The parent on Friday talked about her daughter who, is looking for part-time work now and goes out, with Headspace to actually, go and have her peer mentor. And she doesn't do any of that process any longer, whereas prior to that, Mum was doing everything and organising everything. And to have that separation, she says, now I go out for coffee with my friends and I go, I'm off, I'm off because I want some separation from you. And this is great. And to have that is really important. So, yes.
I'm definitely going to put some info up about the comfortability program on the website, because I'm sure people will be interested and will want to learn more for sure. Now I've lost my train of thought. Yes. What are the secrets to that success that you're talking about for those people?
In terms of recovery, do you mean from pain? In terms
of recovery.
Yeah.
Yeah, you've just described these very inspirational stories.
Well, I think it's really interesting, isn't it? Because the secrets, and they're not so secret, really. They're actually really kind of significant steps. And the first thing is about I would say, let's call them secrets. Let's share our secrets. I say this about, well, it is a little bit like that. And I often say when I'm teaching about hypnosis, actually, and I really wish I'd learned it many years ago, because I feel it's a little bit like somebody said to me, you can go into the sweet shop or the lolly shop, as people, Australians call them lolly shops here. Here's the keys. Go for your life, go and have as many lollies as you like. So let's share our lollies today, hey, of effective recovery. And look, for some kids, it isn't always about, that process is a long journey and it's a tricky journey. And for some kids, there will be complicating medical issues that they have to navigate through for many, for forever in their lives. That doesn't mean to say, though, that they can't have control over pain. So perhaps one of the most significant messages that is important is that your pain is real, and you can start to have some control over this process by following some really key steps. But it's hard work. And when I'm seeding that with a teenager, I'll use whatever I can to seed that. If that teenager's into football, then we'll use football. Have you ever known some incredible footballer, who's got to where they are and not had to practice and not had to actually put in many, many hours of practice to get to how good they are. If you're a writer, if they're like writing, I'll use a literary example. If they're a gamer, I'll use gaming. The dreaded Fortnite. As parents, we hate it, don't we? That we want to get our kids off the screens. But you know what? If I'm working with a gamer, I'll use whatever I can to say, you know what? You're incredibly good at that. So we need to make you incredibly good at managing your pain, because you can do that. Let's get on with it. And we can do it quickly or we can do it slowly, but I'm reckoning quickly is the best way to do this. So shall we get going? And so the steps are, let's get you back to school. Now, what are the barriers about that? That's important that we look at what's getting in the way. So school, and what are the relationships? Who do you want to connect with? What are the barriers there? And so it's looking at those key domains of somebody's life and sneaking in that back door of school, your relationships, your activities, the things that you love, and teaching you some strategies that when pain is flaring, you've got some control, not your pain is controlling you, because that's how people start. That their pain is actually bossing them around and dictating the terms of their life. And to say, well, actually, we need to flip that around and put you back in control. And that is quite liberating, particularly for a teenager who's used to, I think we were talking about that, earlier, that to say that, that they don't have that control any longer. They don't feel that they've got that autonomy to make those choices in their life. So it's about how you see that and how you practice those skills. And it takes a little bit of time, and it takes a little bit of trust as well. So your therapeutic alliance with that particular client is paramount, and meeting them where they're at is crucial. So my top secrets for success are seeding hope, one step further behind that, validation, so your pain is real, and then seeding hope. There's something you can do about that, and then teaching what you can actually do that makes a difference. So they're not really secret, because that's what we do, isn't it? We do that all the time. We just have to make it very relevant to that pain story. So your knowledge of pain education is really crucial. You have to understand the neuroscience behind that. Actually, pain is, that you might feel it in your body, but it's actually your brain that's responsible for delivering that message. And your pain system at the moment is a little bit wonky. So let's actually tweak it a bit so that it's actually giving you more reliable information, because it's giving you some wonky signals. So let's interrupt that signaling process and let's just experiment. And I'm curious to know how that will happen, and let's just see. I don't know, and I'm the fan of saying, I don't know, you've got the control here. I've just got a whole heap of skills. Let's share.
I love that. Did they teach you to use the word wonky in your neuroscience training?
I'll use whatever. It's gone a bit wonky. Is that an Australian term? Do Australians use that?
It is.
Oh, cool.
No.
That's why then.
Yeah,
They use a lot of Manchester terms, and people say, what are you talking about? What are you actually talking about?
Hey, Nicki, if someone's listening to this interview and thinking, wow, this is an area that I'd really like to work in, why should they?
Oh, because we need you.
Okay.
We need you. Look, first and foremost, we started out with, you said, why? You asked me earlier about the message about pain. It really is something that's only begun to blossom relatively recently. So I'd say that the number of psychologists working in pain services are few and far between. And when I'm liaising with psychologists in the community, they'll either say to me, I didn't realize pain was an issue, or we don't come across that. Well, that doesn't translate to, if there's 1 in 4 kids that have got chronic pain, then what's the breakdown here? Because it is around. So, we need more knowledge about how pain actually influences mental health and how mental health influences pain. Sleep is a big factor there as well. So we really, really need more psychologists, particularly, to be trained about pain neuroscience. And I think, certainly when I'm teaching health psychologists at Adelaide, that we do snapshots of it. But I would say that we're not wonderfully confident in how we deliver that message. And confidence is a real, you have to be confident in delivering what you want to say. You could say that, if you're going to explain how anxiety works or how depression works. I think when we can confidently deliver our message of what role the brain and the body play in its interchange with one another, we really sell our story. So good neuroscience knowledge, I think, is helpful for all psychologists because it helps to explain the message. So please come and work because we need more psychologists to know this information. And secondly, you actually make a difference. To be, oh, look, I sat with a parent in the program on Friday and, explained what's actually occurring here. And that's just a day, that's just a day program. And this parent came up to me at the end and said, nobody's talked like that to me before. Nobody's explained it in that simple way before. And that just makes such sense. And that's incredibly rewarding to say, I can just shift that so easily just with, how I explain the message, really. And when you can explain it in a really simple way, then you can start healing. You can start the process of recovery. You can start the process of putting in place active steps that are going to make a difference. So why wouldn't you want to have that influence? I'm saying, why wouldn't you want to make such a difference? It's really easy when you've got that, when you have that script. It's not tricky, and it's really rewarding work. And also, you get to work with other professionals, certainly in pain services. I adore working with other colleagues, my other allied health colleagues, physios, OTs. When you work collaboratively, it makes you a better psychologist because you see things from a different point of view. We have an incredible pediatrician who we work with, and that medical perspective, she's incredibly therapeutic in her approach. So that makes me a better professional, and I want to be good. I mean, all psychologists, we're all secret, not so secret perfectionists, really, aren't we? So, why wouldn't you want to be good?
Perfect at everything we do.
Yes, absolutely.
Right.
That's right. High expectations,
Hey, Nicki, if people want to ask you more about how to get into this area, can they contact you directly?
Definitely.
Okay,
Would love awesome. That to happen. Yeah. And
that's awesome. Sorry, I cut you off then.
Oh, sorry. I was going to say, the way to just my contact details for email is probably the best way to get hold of me. Shoot me an email.
Beautiful. I've got one more question for you.
Mm-hmm.
What's exciting you about the future?
So we are at the moment looking to how we develop things, certainly in South Australia, and we want to really grow provision of care for all individuals who have chronic pain, not just kids, but adults. And we're really fortunate that our program that the comfortability program, we're just evaluating that. So we've got some research that's about to just kick off. We've just got ethics approval to evaluate what we're doing. So that's really exciting. And tagged on to that is an online chat forum for teens that's connected to the women's and children. So connected to the comfortability program. And that's really exciting too, because to be able to have accessibility that's in a safe way about learning skills and learning, sharing resources is really important. My vision is one of, let's think much bigger than where we just are. Let's think. The comfortability is an international program. It's run out of the US and just been picked up in Canada, actually, as their first line intervention program through pediatric services over there. So let's think big. Let's talk to one another. Let's learn from one another. We're those of us who work in pain. We're not doing anything radical or, in terms of different from one another. We're all doing very similar things. So let's share. Let's learn from one another. Let's spread the word. And by doing that, we actually make a difference more quickly for people who have chronic pain. And that's the point, really, because we want to we don't want this process where a patient's come into the service and said, I've had this for such a long time, and I've become so stuck. So let's start working more quickly and faster, and let's start talking to one another so that we actually make a difference faster. And that's what excites me. So let's actually coordinate what we do more quickly. And as I say, we're lucky that here in South Australia, we've just been appointed a state lead. We have a fantastic clinical psychologist, actually, Anne Burke, who is also head of who is the Australian Pain Society president as well. So we've got a lead for chronic pain, which is amazing. So we can collaborate more, and let's just keep talking. That excites me, because what we can do together collectively is far better than what we can do on our own. And I guess opportunities like this, Amy, that's really good too, isn't it? Because that's what you're saying, the same thing. Let's just keep chatting. That's what psychologists do well.
Thank you for encouraging me and our listeners to think big today, Nicki. It's been lovely chatting with you. So thanks for coming on to We All Wear It Differently.
No worries. It's been lovely talking to you, Amy. Thank you for the time. Really appreciate it.
Thank you, Nicki. I've learned so much about working with young people experiencing chronic pain and, of course, their families. So thank you. I hope you enjoyed this podcast as much as I did. For more information on Nicki, check out the show notes. This episode of We All Wear It Differently was brought to you in collaboration with the Australian Psychological Society as part of Psychology Week 2020. For more information, head to psychweek.org.au, and to subscribe to the podcast, head to weallwearitdifferently.com.
You've been listening to We All Wear It Differently. Subscribe at weallwearitdifferently.com.